Another hyperdense vessel, we've seen 3 now, MCA, basilar tip. Another hyperdense vessel in a check area, particularly in a young adult female patient on the pill presenting with headache, is the dural venous sinuses. This is the normal density of that dural venous sinus on the right-hand side, and compare that to this side. So it's looking pretty similar. On these windows, are looking pretty similar to the skull next to it. So this is a hyperdense transverse sinus in this patient. So that is suspicious for dural venous sinus thrombosis. The diagnostic test is a CT venogram. A lot of people ask for MR venograms. That's really a screening test, really. But if you want the diagnosis of dural venous sinus thrombosis, a CT venogram is what you want. And you're looking for a filling defect. Here's the superior sagittal sinus enhancing normally. As we come down, it's going to divide into the transverse sinuses. And you can see the right one is enhancing nicely over here. And then you've got this big filling defect sitting in that left transverse sinus. Okay, so a nice check area. Young adult female patient with headache in particular, because they're quite easily missed. Here's another patient with exactly the same thing, headache, and you can see this is the transverse sinus being nice and hyperdense on this slice compared to normal density on the contralateral side. And I just want to show this one because when we go up to our vertex, which is where we like to start, it's not right up here, is it? You can see normal grey-white differentiation and sulcation on the right-hand side, but we've lost grey-white differentiation. We've got cerebral sulcal effacement, so we've got positive mass effect up here, and this is actually a venous infarct or venous edema secondary to their dural venous sinus thrombosis. So that is another cause of an infarct. Obviously much more common getting an arterial infarct, but you can get venous infarcts. And this is not really conforming to a vascular territory. It's not a common site that you would infarct without infarcting other areas of the MCA territory. So whenever we see that, think about the dural venous sinuses.